Yorkshire Terrier. The Yorkshire Terrier is a small dog breed of terrier type, developed during the 19th century in Yorkshire, England. Ideally, its maximum size is 7 pounds, 3.2 kilograms. A popular companion dog, the Yorkshire Terrier has also been part of the development of other breeds, such as the Silky Terrier. It has a grey, black and tan coat, and the breed's nickname is Yorkie. History. The Yorkshire Terrier, also called the Yorkie, originated in Yorkshire, a county in northern England, and the adjoining Lancashire. In the mid-19th century, workers from Scotland came to Yorkshire in search of work and brought with them several different varieties of small terriers. Breeding of the Yorkshire Terrier was principally accomplished by the people, mostly operatives in cotton and woolen mills, in the counties of Yorkshire and Lancashire. Details are scarce. Mrs. A. Foster is quoted as saying in 1886, "If we consider that the mill operatives who originated the breed were nearly all ignorant men, unaccustomed to imparting information for public use, we may see some reason why reliable facts have not been easily attained." The breed comes from 3 different dogs, a male named Old Crab, a female named Kitty, and another female whose name is not known. The Paisley Terrier, a smaller version of the Skye Terrier that was bred for a beautiful long silky coat, also figured into the early dogs. Some authorities believe that the Maltese was used as well. They were all originally bred from Scotch Terriers, note, meaning dogs from Scotland, not today's Scottish Terrier, and shown as such. The name Yorkshire Terrier was given to them on account of their being improved so much in Yorkshire. Yorkshire Terriers were shown in a dog show category, class, at the time called rough and broken-coated, broken-haired Scotch and Yorkshire Terriers. Hugh L., writing in 1878, says that the classification of these dogs at shows and in the Kennel Club stud book is confusing and absurd in lumping together these different types. In the early days of the breed, almost anything in the shape of a terrier having a long coat with blue on the body and fawn or silver-colored head and legs, with tail docked and ears trimmed, was received and admired as a Yorkshire Terrier. But in the late 1860s, a popular Paisley-type Yorkshire Terrier show dog named Huddersfield Ben, owned by a woman living in Yorkshire, Mary Ann Foster, was seen at dog shows throughout Great Britain, and defined the breed type for the Yorkshire Terrier. Huddersfield Ben. Huddersfield Ben was a famous dog. His portrait was painted by George Earlin in 1891. An authority on the breed wrote, "Huddersfield Ben was the best stud dog of his breed during his lifetime, and one of the most remarkable dogs of any pet breed that ever lived, and most of the show specimens of the present day have 1 or more crosses of his blood in their pedigree." A show winner, Huddersfield Ben quickly became the type of dog everyone wanted, and through his puppies has defined the breed as we know it today. He is still referred to as father of the breed. In North America, the Yorkshire Terrier was introduced in North America in 1872, and the first Yorkshire Terrier was registered with the American Kennel Club, AKC, in 1885. During the Victorian era, the Yorkshire Terrier was a popular pet and show dog in England, and as Americans embraced Victorian customs, so too did they embrace the Yorkshire Terrier. The breed's popularity dipped in the 1940s, when the percentage of small breed dogs registered fell to an all-time low of 18% of total registrations. Smokey, a Yorkshire Terrier and famous war dog from World War II, is credited with beginning a renewal of interest in the breed. The American Kennel Club ranked the Yorkshire Terrier as the 6th most popular pure breed in the United States of America in 2012 and 2013. Coat. For adult Yorkshire Terriers, importance is placed on coat color, quality and texture. The hair must be glossy, fine, straight and silky. Traditionally, the coat is grown out very long and is parted down the middle of the back, but must never impede movement. From the back of the neck to the base of the tail, the coat should be a dark gray to a black color, and the hair on the tail should be a darker black. On the head, high chest and legs, the hair should be a bright, rich tan, darker at the roots than in the middle, that shades into a lighter tan at the tips, but not for all dogs. Also, in adult dogs there should be no black hairs intermingled with any of the tan-colored fur. The fine, straight, silky coat is considered hypoallergenic. Adult Yorkshire Terriers whose coat colors deviate from the standard, or that have woolly or extra fine coats, are still Yorkshire Terriers. The only difference is that atypical Yorkshire Terriers should not intentionally be bred. In addition, care may be more difficult for woolly or cottony textured coats, or coats that are overly fine. One of the reasons given for not breeding off-colored Yorkies is that the color could be a potential indicator of a genetic defect that may affect the dog's health. A careful health screening can clarify if any health risks exist. Coats may vary in color. For example, a grown Yorkie may have a silver/blue with light brown, while another might have a black and creamy color. The long coat on the Yorkshire Terrier means that the breed requires regular brushing. Hypoallergenic coats. The typical fine, straight and silky Yorkshire Terrier coat has also been listed by many popular dog information websites as being hypoallergenic. In comparison with many other breeds, Yorkies do not shed to the same degree, only losing small amounts when bathed or brushed. And it is the dog's dander and saliva that trigger most allergic reactions. Allergists do recognize that at times a particular allergy patient will be able to tolerate a particular dog, but they agree that the luck of the few with their pets cannot be stretched to fit all allergic people and entire breeds of dogs. The Yorkshire Terrier coat is said to fall out only when brushed or broken, or just said to not shed. Although neither of those statements agree with what biologists, veterinarians and allergists know about dog fur, allergists think there really are differences in protein production between dogs that may help one patient and not another. Other colors. The Yorkshire Terrier is a tan dog with a blue saddle. Particolors exist, although they are not correct for the breed standard. The particolor coat is white with black/blue and tan. The white is caused by the recessive piebald gene. It is very rare to get a particolor, and if one is found, it tends to be very expensive. Some Yorkshire Terriers are solid golden, they only produce pheomelanin. Others are liver or chocolate, a brown color, they produce brown eumelanin instead of black eumelanin. See dog coat genetics. The standard prescribes clearly defined fur colors, and non-standard colors may indicate crossbreeding with other breeds or in rare cases even health problems. The AKC registration form for Yorkshire Terriers allows for 4 choices: blue and tan, blue and gold, black and tan, black and gold. Color alone will not affect whether or not a dog is a good companion and pet. Even though off-colored Yorkshire Terriers are advertised at premium prices, being of an unusual or atypical color is stated to be neither new, desirable, nor exotic. Until recently, mismatched Yorkshire Terriers could be crossed with Boer Terriers, a new breed that originated in Germany from particolored Yorkshire Terriers. Although the American Kennel Club will not deny registration of a Yorkshire Terrier on color alone, meaning that particolors are now registerable with the AKC, the Yorkshire Terrier Club of America has a directive that any solid color or combination of colors other than black and tan for adult dogs is a disqualification, and dogs of solid color, unusual combination of colors, and particolors should be disqualified. Puppy coats. It may take 3 or more years for the coat to reach its final color. The final color is usually a black or grayish color. P. H. Combs, writing in 1891, complained about show wins awarded to puppies, when the dog's coat does not fully come in until 3 or 4 years old, and the honor of winning such a prize, for a puppy, can therefore be of but little practical benefit to the owner since the adult dog's color cannot be exactly predicted. Coat care. Owners may trim the hair short for easier care. For shows, the coat is left long, and may be trimmed to floor length to give ease of movement and a neater appearance. Hair on the feet and the tips of ears can also be trimmed. The traditional long coat is extremely high maintenance. The coat might get knotted if not brushed daily. In order to prevent breakage, the coat may be wrapped in rice paper, tissue paper or plastic, after a light oiling with a coat oil. The oil has to be washed out once a month and the wraps must be fixed periodically during the week to prevent them from sliding down and breaking the hair. Elaborate coat care dates from the earliest days of the breed. In 1878, John Walsh described similar preparations. The coat is well greased with coconut oil, the dog is bathed weekly, and the dog's feet are carefully kept in stockings. Temperament. The ideal Yorkshire Terrier character or personality is described with a carriage very upright, feisty and conveying an important air. Though small, the Yorkshire Terrier is active, very overprotective, curious and fond of attention. Mentally sound and emotionally secure ones should normally not show the soft submissive temperament seen in lapdogs, although many exhibit this behavior due to improper training. Because of this, it is advised that a Yorkie would not be suitable for a home with typical young children. Instead, they make ideal companions for older families, with many more reputable breeders routinely only homing to families with children older than about 10 years for the comfort of the dog, but more so for the benefit of the child. Yorkshire Terriers are an easy dog breed to train. This results from their own nature to work without human assistance. They are naturally smart and quick to learn, with many being food and or praise motivated. Because they were developed as a working breed, many need a lot of both physical and mental stimulation, with both long walks/runs but also indoor games and training to keep their mind busy. They are known for being yappy, but many have reported that a contented Yorkie is a quiet one, that will happily curl up on your knee in the evening. However, they are all individuals, with some being much more laid back than others, and the breeder should ideally be able to advise on the needs and temperaments of their particular line. Yorkies are easily adaptable to all surroundings, travel well and make suitable pets for many homes. Due to their small size, they require limited exercise but need daily interaction with people. They thrive on attention and love. Many, however, are more timid around other dogs and prefer to stay close to their humans for comfort. Yorkshire Terriers do tend to bark a lot. This makes them excellent watchdogs, as they will sound the alarm when anyone gets close. However, this barking problem can be resolved with proper training and exercise. Yorkshire Terriers are ranked 34th in Stanley Coren's The Intelligence of Dogs. Health issues often seen in the Yorkshire Terrier include bronchitis, lymphangiectasia, portosystemic shunt, cataracts and keratitis sicca. Additionally, Yorkies often have a delicate digestive system, with vomiting or diarrhea resulting from consumption of foods outside of a regular diet. The relatively small size of the Yorkshire Terrier means that it usually has a poor tolerance for anesthesia. Additionally, a toy dog such as the Yorkie is more likely to be injured by falls, other dogs and owner clumsiness. Injection reactions, inflammation or hair loss at the site of an injection, can occur. In addition, allergies can cause skin to be dry, itchy and/or red. The lifespan of a Yorkie is 13 to 20 years. Undersized Yorkies, under 3 pounds, generally have a shorter lifespan, as they are especially prone to health problems such as chronic diarrhea and vomiting, are more sensitive to anesthesia, and are more easily injured. Teeth. As with all other dogs, Yorkies have 2 sets of teeth in their life. The first set of teeth is the 28-piece deciduous teeth, often referred to as milk teeth, baby teeth or puppy teeth. The second set is the 42-piece permanent or adult teeth. Sometimes the number of permanent or adult teeth may vary, which is fine as long as they do not cause bad bite. When puppies are born, they have no teeth because milk is the only food they need. The deciduous teeth will grow from the age of 3 to 8 weeks old, in the order of incisors, canines/fangs and premolars. Yorkie puppies have no molar teeth. Yorkie puppies will start to lose their deciduous or baby teeth when the permanent or adult teeth come in. The permanent or adult grow when the Yorkie puppies are 4 to 8 months old. By around 8 months old, those teeth should fully develop. The permanent or adult teeth will grow in the order of incisors, canines/fangs, premolars and molars. Molar teeth will develop at around 6 to 8 months old. Yorkies and other small dog breeds may have problems if the deciduous or baby teeth do not fall out as the permanent or adult teeth grow. This is caused by the new teeth not growing right underneath the deciduous teeth. Usually, a puppy's body will absorb the roots of puppy teeth. If the puppy tooth does not yield to the incoming tooth, it should be removed because it can cause a malocclusion or bad bite. Retained teeth can cause tooth decay because food can be easily caught in between the deciduous and permanent teeth. Sometimes the new teeth are forced to grow into an abnormal position and further cause a bad bite. The retained teeth may stay or fall weeks after the new teeth have developed. When necessary, the retained deciduous or baby teeth need to be removed surgically. Like other small breeds, Yorkies are also prone to severe dental disease. Because they have a small jaw, their teeth can become crowded and may not fall out naturally. This can cause food and plaque to build up, and bacteria can eventually develop on the surface of the teeth, leading to periodontal disease. In addition, the bacteria can spread to other parts of the body and cause heart and kidney problems. The best prevention is regular brushing of the teeth with a toothpaste formulated specifically for dogs. Human toothpaste is not recommended, because it foams more easily and may be swallowed. Professional teeth cleaning by a veterinarian may also be required to prevent the development of dental problems. Genetic defects. Certain genetic disorders can be found in Yorkshire Terriers, including distichiasis, hydrocephalus, hypoplasia of dens, leg calvé-Perthes syndrome, luxating patella, portosystemic shunt, retinal dysplasia, tracheal collapse and bladder stones. The following are among the most common congenital defects that affect Yorkies. Hypoglycemia. Low blood sugar in puppies, or transient juvenile hypoglycemia, is caused by fasting, too much time between meals. In rare cases, hypoglycemia may continue to be a problem in mature, usually very small, Yorkies. It is often seen in Yorkie puppies at 5 to 16 weeks of age. Very tiny Yorkie puppies are especially predisposed to hypoglycemia because a lack of muscle mass makes it difficult to store glucose and regulate blood sugar. Factors such as stress, fatigue, a cold environment, poor nutrition, and a change in diet or feeding schedule may bring on hypoglycemia. Low blood sugar can also be the result of a bacterial infection, parasite, or portosystemic liver shunt. Hypoglycemia causes the puppy to become drowsy, listless, glassy-eyed, shaky, uncoordinated, since the brain relies on sugar to function. During a hypoglycemic attack, the puppy usually has very pale or gray gums. The puppy also may not eat unless force-fed. Hypoglycemia and dehydration seem to go hand in hand, and force-feeding or injecting fluids may also be necessary. Additionally, a hypoglycemic Yorkie may have a lower than normal body temperature and, in extreme cases, may have a seizure or go into a coma. A dog showing symptoms should be given sugar in the form of corn syrup or Nutrical and be treated by a veterinarian immediately, as prolonged or recurring attacks of hypoglycemia can permanently damage the dog's brain. In severe cases, it can be fatal. Docking. Traditionally, the Yorkshire Terrier's tail is docked to a medium length. Opposition to this practice began very early in the history of the breed. Hugh L., writing about Yorkshire Terriers in 1878, declared that there is no reason for mutilating pet dogs, and perfect ears and tails should be bred, not clipped into shape with scissors. American Kennel Club and Canadian Kennel Club still require the Yorkie's tail be docked in order to compete at its events. The majority of the rest of the world has adopted a no docking/no cropping rule. Often, a Yorkshire Terrier's dew claws, if any, are removed in the first few days of life, another controversial practice. Similar breeds and crosses. The Yorkshire Terrier breed descends from larger but similar Scottish breeds, such as the Skye Terrier and the now extinct Paisley Terrier. In its turn, other breeds have been created from the Yorkshire Terrier, such as the Silky Terrier. Demand for unusual pets has resulted in high prices being paid for Yorkshire Terriers crossed with various other breeds, which are described with a portmanteau word made up of syllables, or sounds, from Yorkshire Terrier and the breed name of the other parent. Some of these such portmanteau-named crosses can be found on the page list of dog crossbreeds. Two other breeds that look similar to the Yorkshire Terrier and have shorter hair are the prick-eared Norwich Terrier, along with its drop-eared relative the Norfolk Terrier. Another is the Brewer Terrier, which derives from the Yorkshire Terrier. The Brewer Terrier, bred from blue, white and gold puppies named Schneeflock and Schneeflöckchen von Friedheck, owned by Mr. and Mrs. Brewer in Germany, was once considered a variation of the Yorkshire Terrier but has since been recognized as a separate breed by many kennel clubs, including the American Kennel Club, AKC. Teacup Yorkies. Teacup Yorkshire Terriers are very small Yorkshire Terriers. The American Kennel Club and other kennel clubs do not acknowledge the teacup as a variation of the breed or recognize it as a separate variety. Usually a teacup is any dog weighing less than 4 pounds, 1.8 kilograms, when fully grown, when the actual breed standard is given at 7 pounds, 3.2 kilograms, maximum. Breeding for teacup size is a controversial practice that is not encouraged by responsible breeders. They are bred to appeal with their puppy-like features, rather than bred to avoid health issues. There is great risk to a dam, mother, during pregnancy who is too small. Most of these litters are born as a result of cesarean sections and have a high mortality rate. There are many health issues associated with teacup dogs, such as luxating patellae, heart disease, hydrocephalus, hypoglycemia, chronic pelvic pain syndrome, open fontanelles and seizures. Notability. Show dogs. Small dogs. War dogs. White House dogs. War dogs. White House dogs. War dogs. White House